声音太小了，听不着。
新型冠状病毒肺炎疫情防控指挥部关于进一步强化疫情防控工作的通告第17号文的精神，严格人员出行管理，精准实施分级分类管控措施，严格落实涉及重点区域管控要求，全力维护人民群众生命安全和身体健康。今天呢，也是高考的第一天，广大的考生家长和社会呢。
Welcome to the press conference of the COVID-19 prevention control measures of Guangdong City, and today also marks the first day of the college entrance examination. We'd like to brief you the latest update of the COVID-19 prevention control measures together with our measures to deal with the college entrance examinations. So we have invited relative colleagues from the Guangzhou municipal government to introduce you the latest update of the COVID-19 prevention and control measures. Madam Chen Ding from the National Health Committee of Guangzhou, Mr. Zhang Zhongbing, Deputy Director of the CDC Guangzhou, and Mr. Wang Jianxin, Deputy Director of the Transportation Bureau of Guangzhou, and Mr. Lei Gang, the Directors of the Baiyun International Airport of Guangzhou. So, online, we are also going to be connected with the Deputy Director of the Education Bureau of Guangzhou Municipal Government to give you the latest update of the college entrance examinations in Guangzhou. And we have also invited schoolmasters, Mr. Tan Dongling, who is also joining us online. Mr. Tan Dongling is the schoolmaster of the Zhongdian Middle School. We are also going to connecting with Mr. Wang Hongling to give us a brief introduction in the number 8 hospital in Guangzhou. First, we'd like to give the floor to Madam Chen Bing to give you the latest update of the COVID-19 prevention and control in Guangzhou municipal government. Friends from the media, good morning. I'd like to give you the latest update of COVID-19 prevention and control informations. First, I'd like to inform you the latest cases. On the 6th of June, the newly infected cases is 4, and confirmed cases is 3, and asymptomatic patient is 1. All of them is discovered under the great scrutiny, and we have discovered 3 cases in the screenings, and we have also discovered another patient in the close contacts name list. The newly added 4 cases is discovered in the Liwan district. So far, we have reported 97 domestic cases, among which 84 of them is confirmed cases, and the others, and 14 cases are asymptomatic cases. All of them is being treated in the number 8 hospital of Guangzhou municipal government. The second part I'd like to brief you is the screening measures in Guangzhou. So far in Guangzhou, we have connected we have set up over 2,000 testing stations, and there are 67,000 people being a part of the sampling and NAT testing. After 3 days of the rapid work, we have collected the samples from 1 million people, and we have collected 6 different positive results. Starting from the 5th of May, we have collected the samples from the Shenzhen, Shaoguan, among other different cities. All of them is actually supporting us with the PCR testing. So I also want to thank all the participants from all the volunteers from other different cities and provinces for your good support of the prevention and control of COVID-19 measures in Guangzhou. And I also like to report to you about the medical workers fighting in the front line of COVID-19 in the Liwan district. Starting from the 29th of May, in order to protect the health of the citizens in Guangzhou, we have issued the number 30, number 16, and number 19 public policies. And the Liwan district is actually under huge pressure of the prevention and control measures. The southern part of the Liwan district has followed the strict measures, and also they are using their real effort to demonstrate their love to their homeland, also to their country. So while we are controlling and while we are under lockdown, it has brought a lot of difficulties to the citizens, especially if they want to seek the medical treatment. That's the reason why we have organized medical forces to try our best to meet up with the demand of the 9 districts' citizens' medical treatments. For one part, we have coordinated the medical resources. In the southern part of Liwan, we have coordinated the southern part of Liwan and also its square resources. And we have divided the southern part of the Liwan district as the district or community A, and that is the 100% lockdown area, and also the district B, which is not 100% lockdown areas. And at that area, we have dispatched the team of internal medicine, outpatient department, OBGYN, among other different treatments to provide the patient a very in-time treatment. We have also organized a 20 medical workers team to dispatch a 24-hour, 7-day television hotline, and we have also set 115 different medical workers from 9 different hospitals in our city to assist Lian, and we have also dispatched 9 community-level hospitals to open up to the residents. That is to say, for each one of the local community-based clinics, they are going to face up with the citizens' residential demand. And for the second bunch of the supporting team, they are gradually enforced. And for the third bunch of the medical workers, we have added 142 medical workers to support the OBGYN institutions, and we have all added 59 different emergency workers. And we have also set up 4 online hospitals for the emergency treatment. Thirdly, for the special medical demand for those pregnant women, and we have circled out 3 level 3 hospital in the lockdown area, and where we find a lot of pediatricists together with the patient gynecologist to work for the best of the patients. That's the reason why we have selected the information for the community level hospital, and by coordinating the effort from the region, we have dispatched the citizens to work in the district to provide the guaranteeing for the citizens. For some of the chronic disease patients, including the diabetes and also hypertension, we provided front door treatment. And for each one of the citizens, they are going to follow a very strict timeline to get out of their own home. And they are also going to get the drug in a designated area. And if those are citizens who cannot get into the door, we are going to organize volunteer teams to dispatch or deliver the drugs at their front door. We are also working with 3 different institutions with the provincial government's TCM hospitals. We are going to dispatch some of the TCM packages, and for some of the patients enrolled in the psychological treatment, we are trying to optimize their psychological treatment. At the same time, in the area A and B, we are going to organize the temporary enrolled area for the hospitals. For those of the citizens who might suffer from the difficulties in the transportations if they want to seek outdoor medical treatment, they can dial the telephone number of the local community level treatment. We encourage the citizens to go to the medical institutions, and this is also going to save the rare emergency resources. So currently we have built a 3-level medical guarantee system, and this is going to address the citizens' medical treatment. I hope all of you can make use of the medical resources and trying to avoid the virus infection. Finally, I kindly remind all the citizens that in our city, the prevention and control measures is at a crucial stage. All the citizens are not outsiders. With the wild participations of the COVID-19 prevention and control, we encourage all of you to work in the key areas. And for those who get a close contact with the citizens, please report to the local community officers and please conduct a PCR test as quickly as possible. Only as we have drawn our effort, we are going to win the battle against COVID-19. Thank you. Thank you very much, Madam Chen Bing from the CDC Guangzhou, for your latest update of the COVID-19 prevention and control. And you have also introduced us that the prevention control measures in the key areas, especially the medical resources, and also the psychological treatment and mental health. And she is also calling for the citizens to work together to win the battle against COVID-19. Thank you very much, Madam Chen Ming. Now the floor is given to Mr. Yang Bingsheng, the Deputy Director of the Public Security Bureau of Guangdong Place, to give us some of the latest update and also about the college entrance examination. Dear friends from the media, good morning. I'd like to report to you the measures of the Guangdong Police Force and the prevention control of COVID-19 and how do we guarantee the college entrance examinations. And this is also going to help us to cut down the spread of the COVID-19. So starting from the 25th of May, Guangzhou Police Force has dispatched for around 12,000 workforce to be stationed in the hospitals, in the recovery areas, and in the PCR testing areas, and also and we have dispatched our police forces in the Liwan, Haizhu, Nansha, among other different districts. There's over 5,000 police force, and this is going to help us with the long-term prevention and control of Guangzhou. And in the key areas of the prevention and control, we are trying our best to prevent and control the multiple levels. And we have initiated a multiple-layer, coordinated and signified mechanisms with 6 different teams working under it. This is also for the real translation of the effort. So starting from the 1st of June, the Bureau of Public Security has selected 1,432 different police forces to monitor the different key areas of the Liwan district. And second, we are using a very strict measures to maintain the orders of the PCR testings, and Guangdong Police Force is continuing our effort with the community level government, with the streets, and we are trying to grasp the latest update of the vaccination time, and so we are also going to allow the police forces according to the different positions, and this is how we are going to guide the PCR testing. For some of the citizens who might be misbehave, we are going to give them some of the alarms, and we have also guarantee the safe transportations of the testing agency and also the vaccines. Thirdly, relying on the big data and also the management of the populations. We have, and moving forward, the Guangzhou police force is also going to use the big data of the police force to form a prevention and control 24-hour early alarm mechanism. And this is also going to support the healthcare management mechanisms. At the same time, for the 2,700 different management stations, we are going to coordinate the workers from the healthcare, from the community workers. And this is also going to help us to land and translate the numbers into realities according to the suggestion of the healthcare committee. We are going to follow up all the different close content of the COVID-19 pandemic, and we are trying our best to exclude any potential crime in the community level. Fourthly, we are going to implement all kinds of measures. We are using the new media and social media to give the latest update of the general public. And in the level-based prevention and control areas, we are going to use the drones flexibly and to broadcast the prevention and control measures. And also the police force is actually goes into the different districts to promote the prevention and control concept. And household by household, we are going to help the citizens to overcome their difficulties. And recently, because Guangzhou is of high temperature and is raining frequently, so we need to ease the tensions of the citizens. If they wait too long, we are also going to help the elder citizens to write in the forms. And this is also going to help us to promote the concept of the anti-graft and anti-forgery for the citizens. For the key areas, there is around 1,500 police force assisting the community that they are living in. And they are also trying to build the second ladder for the prevention and control of COVID-19. In terms of the guarantees of the college entrance examinations, based on the new features of the COVID-19 pandemic, Guangzhou Police Force has set up the guaranteeing measures. And so far, the students in the college entrance examinations, they are going to stay at their doors. And we are not going to arrange the students from medium risk to go to the high risk. And for the students who are living in the lower risk areas, we are not allow them to go to the medium risk areas. And I believe the students should follow the drawing on the map to figure out their examination center and also examination classroom. And we have also generated point-to-point specialized driver together with the students, and this is also going to guarantee a smooth transporting of the students. At the same time, Guangzhou Police Security has upgraded our emergency level at another higher alarming, and we are also trying to depend on our dispatch of the police forces and trying to deal with rumors about college entrance examinations. So with the features of Guangzhou City, Guangzhou has also kindly reminded that all the different safeguard might experience some of the clashes. For each one of the examination sites, we are going to set up 6 different professional medical workers. And for each one of those who get an A or an B, they can went through the test according to the evaluation results, just like Harvard University. And we have also dispatched 35 different mobile vehicles to see the alarms. Moving forward, Guangzhou is going to continue our journey. And I believe that this is going to help us with the crackdowns of the COVID-19 prevention and control measures. By using the social power and social security, we are going to fully win the battle against COVID-19. Today is actually the first day of the college entrance examination. So what I want to say to the college entrance examination, the takers, the students, is that the police force in Guangzhou is going to work as the Guangzhou Yuexiu government to provide you the latest update about that. Thank you. That is the end of my speech. Thank you very much, Mr. Yang, for your kind introduction about an overarching effort across the city and the police force. And Dr. Yang also gave us a very clear introduction toward the citizens' awareness. And this is a very warming service. And it's also going to guarantee a smooth operation during the prevention and control measures of the city. And I believe that we are opening a very ordered channel. Thank you very much, Professor Yang. Now the floor is given to one officers that really caught up the interest for all of you. And the 9 a.m. this morning, we could see thousands of millions of the college entrance students, college entrance exam takers, the students who is about to enter into that part. So that's the reason why we are going to invite the person who is responsible for the college entrance examinations to answer the question like that. So Director Wu, the floor is yours. Director Gu, can you hear me? Director Gu, can you hear us from the side? So please switch the camera toward Mr. Gu. So now we'd like to give the floor to the schoolmaster of Jingdao. And we all know that Jingdao Middle School is one of the key schools located in the center of Guangzhou. We'd like to give the schoolmaster a floor toward what is the latest update of that. Good morning. So since the prevention and control mechanism of Guangzhou municipal government has announced the Jingdao Middle School as one of the middle schools hosting the COVID-19 infected or asymptomatic patient, Jingdao local middle school has been utterly transferred and utterly sterilized, and we are making sure there is no single area left that at the at the Thursday, Friday, and Sunday, we are conducting a very strict sterilization process, and we have also tested the environment for the key areas, including the cities. At the 6th of the May, we are trying to contact with the close contact, other with the other different contacts. So if there is around 257 participating in the college entrance examinations. In order to avoid the gathering, the school has set up a separating line along with 150 meters. And in the school, we have also set up the 15 centimeters length. And we have professional people reminding that the college entrance exam takers is going to went through the testing, body temperature testing 2 times of the sterilizations, and they are also going to replace their medical mask into the medical mask that is being provided by the examination room. And during the examinations, the students should wear the medical mask all the time. When the examination is taking place, the door and the window is going to be open. This is going to guarantee a safe and also sound prevention and control measures of COVID-19 to guarantee the successful opening and successful holdings of the Guangzhou government. We have set up the professional vehicle service, and on the 6th of May, we have done the relevant teachings by the numbers that the students arrived from our school. We could see that all the students who delivered is going to be delivered before the 8:20 in order to address the students' demand of living in the school during the lunchtime and after lunch nap. The school has decided and amplified one ground and we have recruited some of the companies in the catering industry to provide the best dishes allocation. And this is also going to guarantee a safe operations for the successful of the college entrance examinations in Guangzhou. Thank you very much, Mr. Tan Dongming. I believe that you have 130 students at your hand. You are making a lot of effort. I'd like to say hello to all the teachers and citizens. Now the floor is given to the live streaming areas of the Guangzhou Educational Department. Mr. Gu, the floor is yours. I believe we'd like to kindly invite you the general briefings of the college entrance examinations in Guangzhou. The overarching picture for Guangzhou signal is that generally to say it is safe and all the people are following very strict measures. If we have set up the examination areas, we have some of the plan areas, including 18 different testing center and examination centers, among which 12 million people. And even if in the number 8 hospital of the Guangzhou province, we provided around 7,000 total workers treating them. This is the general briefing, and secondly, I'd like to brief you the students who is actually taking in the examinations. There is around 54,000 students, but actually the attendees is around 52,000. Overall speaking, the data is quite good. At the same time, we have some of the students who is receiving their education in Guangdong and also who is going to take up the college entrance examinations in other different provinces. So I believe the transportations of the college entrance examination taker is very important. We should see them being located in the medical areas. So under the joint support of the medical workers, I believe all the students is arriving there at the same time. For the COVID-19 prevention and control measures and for the closed content. And for the confirmed cases, all the positive results, we have 141 confirmed cases. It includes some of the students who is actually taking the examinations in Guangzhou, but actually from the school in Foshan. And they are all being resigned in the medical areas. And for the full close contact, one thing to be remembered, to be mentioned, is that for the 2 students in the medical area, with the guarantee and help of the teachers, I believe that they are working in a very normal circumstances. During the prevention and control measures of the examinations, the teachers and students has went through 2 rounds of the NAT testing. This has provided a very safe and sound measures, and also I'd like to introduce you the surrounding environment. We have tested around 1,180 different NAT testing samples, and we could find that there is nothing particular. And generally speaking, let me sum it up. So the students has entered into their examination center in an orderly manner. The second sentence I like to summarize is that it is well organized, and especially the ID recognition process is well organized. The third one is that the dispatch of the testing paper is very precise. No matter from the regular testing center or the quarantine testing centers or other different areas, it is very precise. And the third word is that after the previous guaranteeing effort, all the different equipment is being operated in a very effective manner. And the fifth word is that through the monitoring system, the examination is went through according to the requirement. And the sixth sentence I like to share with you is that we have selected the environment and we have, under the joint effort of the public security bureaus, and we have the confidence that we are going to maintain a very orderly manner, and this is also going to help us with the prevention and control measures, and this is also going to help us in the future battles against the COVID-19. Thank you very much, Director. Thank you very much for your introduction. So we are going to connect with number 8 hospital of Guangzhou City, number 8 affiliated hospital toward Guangzhou Medical University. Good morning. I'd like to give you a brief introduction to the two students who is taking their exam at our hospital. There are two cases who is actually quarantined in our hospital. They belong to the category of asymptomatic patient. Currently, under my observation, they are in good mood and in good medical condition. So please be assured about their conditions. I also like to introduce you the preparation effort in our hospital. The first one is that we have opened up the green channels for the college entrance examination tickets. And today we have conducted an all-rounded test. And from their emotion, they are really stable. Secondly, before the college entrance examination, we prepared a very nutritious food package for all of them. And this very unique testing center, we are afraid the kids might be under too much mental pressure. That's the reason why we have arranged a lot of psychologists to give the students mental support. And we have used the arranged 4 rooms of the examination center. And before the examination, the Education Bureau and Education Committee of our city has dispatched 4 officers to check the environmental conditions for this testing, for the examination center that is set up in our hospital, and all the measures is being qualified. And they are also stationed on site the testing examination center in our hospitals, and also we have dispatched some of the medical workers to be ready to save the students at any time. If the students have any demand, they are going to wave to the observation cameras, and also the teachers who is monitoring them is going to inform the medical workers. After that, we are going to sterilize the paper that the student has written on. This is going to guarantee a very special but memorable college entrance examination. We are going to make sure that the students is going to enjoy their college entrance examination. Thank you very much. That is my introduction. Thank you very much, Deputy Director Luo Hongbin, for your kind introduction. I also want to say hello to all the medical workers who is fighting at the front line of the number 8 hospital, affiliated to Guangdong Medical University. I also like to thank all the different participants online. Thank you very much. Now the floor, we are going to enter into the second item of today's agenda through the brief introduction online and offline. So we are going to give you a very brief picture about what is happening right now. So now the floor is open for questions. So friends from the media, please identify yourself and affiliated your institution before the questions. Thank you. Please deliver the microphone to the madam at the second row. So I am with Southern Metropolitans. So yesterday, I heard the Guangzhou municipal government has unveiled the number 17 public announcement. So how do you implement the requirement of the number 17 policy? So we are going to direct this question to Mr. Yang Bingsheng, who is the Deputy Director of the Public Security Bureau of Guangdong Province, in order to implement the number 17 policies published by the Guangdong municipal government. So if the any citizens living in Guangdong, they should not leave Guangdong under unnecessary conditions. The policy is going to start its effect at the 12 a.m. at the 7th of the June. And we are also going to set up the 120 different information palette. And all the informations and reminders is going to be broadcasting and live streaming on the rolling palette. And we are also working together with the transportation bureaus to implement the procedure. Thank you very much for your question from the Metropolitan Daily thing. So my question is directed to General Secretary Wang from the Guangzhou South Railway Station. So can you give us the latest update of Guangzhou South Railway Station? Thank you very much, friends from the media. According to the prevention and control policy requirement of Guangzhou municipal government, and according to the management of the headquarters, Guangzhou Nan Station is going to test every single passengers about their PCR testing result. So starting from the 12 a.m. today, any travelers who is going to take up the bullet train in Guangzhou Nan Station, they are going to provide a negative PCR testing result within 48 hours, and their body temperature should not be higher than 36 degrees centigrade. Starting from 12 a.m., I want to emphasize once again, the time period is going to be shortened from 72 hours to 48 hours. In order to test about that, we have launched a platform, the testing and the examining platform. Of course, in the examinations, we have tested around 12 different testing areas. The travelers, by a simple scanning of their ID card, they can show their result of the QR code, health QR code, and also their epidemiological histories. In the year 2021, before the 18th of the 6th of May, the travelers who bought the tickets, they should return their tickets. If anyone want to rebuy their tickets, it is free of charge. So when they try to rebuy their tickets, the insurance is also going to be repaid by 100%. For the relevant tickets, they can also return their tickets, and we don't require any procedure fees. So using these opportunities, I'd like to remind the dear visitors or dear travelers for 3 different aspects. The first one is that before you enter into Guangzhou Nan Station, please follow the guideline of the workers and staffs from the Guangzhou Nan Station, and please show you QR code and a healthy code, and went through a PCR testing. For those who rejected us, we are going to submit them to the police force stationed at Guangzhou Nan Station. The second part is that we kindly remind all the travelers to rearrange your traveling plan. Before you travel to any destinations, please identify the latest information about the areas where you set up your journey. And the third reminder is that the entrance and also the taking up of the train, please wear a facial mask, and do not remove the facial mask during your journey, and do not talk to other visitors. Please keep a 1 meter distance with other different travelers. Thank you very much. Thank you very much with Phoenix News. So my question is directed to Mr. Lei from the Guangzhou Baiyun International Airport. We all know that starting from the 7th of the June 2021, all the travelers who are departed from the Baiyun International Airport is going to demonstrate their QR code, green QR code, and also their previous epidemiological history, and also negative PCR testing results. So how do you respond to that, Mr. Lei? Thank you very much, President. I'd like to give you a brief introduction toward what we are doing in the Baiyun International Airport. According to the number 17 announcement in the Baiyun International Airport, starting from today, we are going to conduct a green QR code and a 48-hour negative PCR testing results for all the passengers depart today after 12 a.m. So at the very beginning of the terminals, we are going to check the green QR code, and before the security check, we are going to test the 48-hour negative PCR testing result. In the boarding gate, the green healthy QR code and also the 48-hour PCR testing result is going to be tested and reviewed again to make sure that all the travelers have the certificates with them. If during the testing, the QR code or the PCR result is not in line with the requirement, the international airport and also the air traveling companies is going to freely return the tickets free. And at the Baiyun International Airport, we are actually setting up a very clear reminder, and we have also shortened the time period once again from 72 hours to 48 hours, and we are also, for every 2 minutes, we are going to broadcast that to remind the travelers to prepare the PCR testing result within 48 hours. And we are also using the airplane companies, air traveling companies to send a message to travelers. And also the PCR testing result for the negative result through the hotline of the Baiyun International Airport 020121100. We are going to explain to the travelers toward what is happening in the Baiyun International Airport. For the traveling policies for the travelers, it's for the Baiyun International Airport. We kindly remind all the travelers to form a scientific foraging plans, and we kindly remind all the travelers to wear the facial mask before the journey, and during the journey, please work online. Please test and check the registration procedures. That is the latest update from Baiyun International Airport. Thank you very much. With Guangzhou Television, my question is directed to Madam Zhang from the CDC Guangzhou. Guangzhou suspended the inoculation of the general public. So many of the citizens has been injected for the first series of the vaccines, but they are waiting for the second injection while the city has suspended the injection. So, Mr. Zhang, how you respond to that? Thank you very much. Actually, the inoculation procedures of the COVID-19 vaccine has been a real concern for the general public because we need to conduct a large-scale PCR testing and we need to gather up all the medical resources in the prevention and control measures of the COVID-19. So the vaccination, we have suspended the vaccination for a time period. Now, I'm really happy to announce that starting from yesterday's afternoon, we resume the opening of the secondary injection appointment channel for those citizens who are not living in the lockdown areas. If they are in line with the following two conditions, the first one is that if they have received the first injection in the Guangzhou city, and secondly, if their first injection has been surpassing the 21 days, you can follow the Guangzhou WeChat account that is being designed by the Guangzhou National Health Commission Guangzhou. And after you enter into that public account and you click the number, and you are going to see your special appointment channel. I also want to kindly remind you that the second injection is for those who are actually the second injection should be conducted within the same district as the first injection. Second, the appointment service is only open to the public who is living in the lower risk region. No appointment, no inoculation. Thirdly, after the 20th of May, those of the citizens who have went to the lockdown area or have fever that is higher than 37 degrees centigrade or who suffered from the fatigue, shortness of breath, or the diarrhea, we need the general public to provide PCR negative result to be inoculated and appointed on site. After the successful appointment with a very good PPE, the public can went to the inoculation site to get the vaccine. Thank you very much for the questions. Thank you very much for the information on the stage. Through today's presser, we have informed you the latest measures of the prevention and control in the city of Guangzhou. We have also invited and we have also introduced the city's management and also the latest information for the college entrance examinations, especially the key areas. And we have also answered the question from the media, especially after the 12 a.m. today, June the 7th, 2021. We are going to start a stricter travel requirement. So we are going to continue the latest information of the Guangdong government. And I kindly invite all the citizens to suggest and give us feedback. Thank you very much. I'll see you tomorrow.